have died.
You would have what?
Dr. David Axelson believes it is a rare case that is clear-cut.
Why? Well, how come you wanted to bust your head open?
But in September of 2000, he was referred a 5-year-old patient, Jessica.
Okay. Now, when you were at Walmart, was this sort of a normal kind of happy feeling, or was it kind of different than just having fun?
She arrived at his office displaying textbook symptoms of adult bipolar, including grandiosity and euphoria.
And I was trying
Dr. Axelson was so intrigued that he videotaped the session.
What?
to fool those two.
You were trying to fool them? Uh-huh. What were you trying to do to fool them?
I was trying to take their head away to fool them.
Trying to take their what?
Their head away.
Trying to take their head away. How could you do that?
I can just get a knife and go.
Really? And you wanted to do that to your folks?
I don't.
Interesting thing about Jessica is she did really present in the office with symptoms. A great deal of aggression and morbid thoughts and grandiose thinking that she could do anything.
Just jumping off of everything, climbing on everything.
In addition, she had a very clear 2 to 3 week period of depression. You know, she was not caring for herself, not getting out of bed. She was just sort of staring at the wall.
She didn't want to eat. She didn't want to do anything.
Uh-huh.
She wasn't angry anymore. She just wanted to curl up in a ball and have the TV on and not move.
Okay. And
Jessica was diagnosed with bipolar 1, the classic form of the disorder. Its hallmark symptom, expansive, grandiose thinking.
I could even lift them up and put them on the roof and bust their head open.
I see. Okay. Lots of talk about busting heads open, huh?
Hey, how you guys doing? Good. Hey, Jessica, good to see you. Come on back. Nice.
Jessica is now 12 years old. Dr. Axelson still believes she's a clear-cut case of bipolar.
And how would you say your mood has been over the past few weeks?
Pretty good.
Mm-hmm.
I cry and scream a lot, though.
You do. And that's kind of a change compared to a few months back, I would say. Has something been bothering you, do you think, in particular? Or something been on your mind or worrying you? Okay.
This girl at school, I'm worried about what she's going to say when I go back to school, what she's going to do because she's really mean.
Mm-hmm. So
On top of Jessica's worries about school, Jessica's dad has just been deployed to Iraq.
Does it make you sad thinking about it some? That's totally normal.
There
you go.
It's okay to be sad.
In the midst of all this, Dr. Axelson has to sort out what are normal childhood stresses and what are the actual symptoms of bipolar disorder that need medication.
You know, there's no scientific answer here about what to do. Well, I think we should try to go up a little bit on the medicine. This is definitely more than just her a usual reaction to the stress, and we don't want to go into school with things being pretty rocky.
Okay.
Okay. Does that sound like a plan?
All right.
Okay.
Some people just don't understand that I have bipolar. It's kind of hard. But as long as I'm taking medication, then I'll be fine. It's the only way to keep me settled down. Taking my medication makes me more calmer, more like I'm supposed to be.
Where's the chocolate card? Oh, there you are.
We're talking about putting a small child on these heavy medications.
$1.75.
She can't go a day without medication. That it's a big burden for her. She may not feel it now, but I feel it for her.
Cool.
And I wish she didn't have to do any of it.
I guess we better go over to the truck and...
If you ask me, what is the greatest challenge facing American child psychiatry right now, it's in the area of bipolar illness. How should we treat it? We have to know the answer to that question. Are the treatments that we use safe for the brain or deleterious? And the tragedy is not that this question is being asked The question is that we're not generating the data which will give us the answer.
Virtually